Vitamin B6 toxicity is one of the few concerns about water-soluble vitamins that has some scientific backing, yet it's also one of the most misunderstood and overstated risks. While excessive intake of B6 over extended periods, typically above 200 to 500 milligrams per day, has been shown to cause sensory neuropathy, the widespread fear of toxicity has had unintended consequences. It has discouraged both individuals and practitioners from using B6 supplementation, even when clearly needed, and has contributed to the broader underappreciation of this essential nutrient in clinical and preventive health settings. The toxicity associated with B6 is unusual among B-complex vitamins, which are water-soluble and generally excreted easily in the urine when consumed in excess. But B6, particularly in the form of pyridoxine hydrochloride, the most common supplemental form, behaves differently. When taken at excessively high doses, especially over long periods, it can interfere with nerve function, ironically producing the same kind of neuropathic symptoms that a deficiency causes: tingling, numbness, burning sensations, and sensory disturbances in the hands and feet. However, the threshold for toxicity is much higher than most people realize, and the body has a fairly wide tolerance range. Clinical reports of B6 toxicity usually involve daily intakes far beyond what the average person would take without medical guidance, often in the range of 500 milligrams to 2,000 milligrams per day, and for months or even years. Most cases have been associated with megadoses taken for energy enhancement, PMS relief, or as part of unregulated megavitamin regimens. When the symptoms occur, they are typically reversible upon cessation of the supplement, especially if recognized early. Still, the existence of these reports has cast a long shadow, leading many clinicians to be overly cautious and many patients to avoid supplementation altogether, even when they're clearly deficient or symptomatic. This caution would be more justified if B6 were a rare nutrient in the diet or one that had limited therapeutic range. But the reality is that subclinical B6 deficiency is surprisingly common, especially in people with high stress levels, chronic illness, poor diets, or those on medications that deplete B6. Despite this, many avoid even modest doses, such as 25 to 100 mg/day, out of fear that they will experience toxicity. Unfortunately, this fear can prevent individuals from gaining the benefits B6 offers in neurological health, immune modulation, hormonal balance, and metabolic support. Moreover, current dietary recommendations may not be sufficient for everyone. The RDA for adults is around 1.3 to 1.7 milligrams per day, a level based on preventing overt deficiency symptoms such as anemia or dermatitis, but not necessarily optimized for mental clarity, neurotransmitter synthesis, or stress resilience. For individuals with increased needs, such as pregnant women, those with high-protein diets, or people under chronic stress, higher intakes are often necessary, yet go unprescribed because of a generalized fear that more might be harmful. It's also important to differentiate between the forms of B6. Most toxicity reports are associated with pyridoxine hydrochloride, the synthetic form found in many supplements. Pyridoxal 5-phosphate, PLP, the active coenzyme form, is less commonly used but may be less likely to cause issues at higher doses, although the research is still emerging. Some researchers suspect that pyridoxine may competitively inhibit the body's own use of PLP when taken in excess, further complicating the toxicity picture. But again, these concerns are relevant only at unusually high doses, not the modest therapeutic doses that help correct deficiency and optimize health. Ironically, this pervasive fear of B6 toxicity contributes directly to its underuse in clinical practice. Many healthcare providers focus on folate, B12, or vitamin D when addressing fatigue, mood disorders, immune function, or nerve pain, overlooking B6 entirely, even when symptoms suggest a likely connection. This not only limits the therapeutic toolkit, but also leaves many patients struggling with issues that could be improved or even resolved through targeted B6 supplementation. In summary, while B6 toxicity is a real phenomenon at very high doses taken chronically, the fear surrounding it is disproportionate to the actual risk for most individuals. Modest supplementation in the range of 10 to 100 milligrams per day is not only safe for the vast majority of people, but also deeply beneficial, especially when correcting deficiency, supporting neurological function, or managing symptoms like nausea, irritability, or neuropathy. The ongoing stigma around B6 supplementation is a classic case of overcorrection. In seeking to avoid the rare risks, we've neglected the far more common and consequential problem of B6 deficiency. With informed use and realistic dosing, B6 can reclaim its rightful role as a powerful and safe tool for foundational health.